Welcome to True Health Tuesday, and the truth will set you free. I've had some weird comments on that too. Okay, we're going to talk about, this is kind of a play because next week tomorrow I'm going to be in Thailand. Although I'm leaving tomorrow and I'm arriving 2 days later, even though it's a one-day travel because we have to cross the date line. It's kind of cool. But in there, I'm going to talk about case studies. And the key, because like the majority of doctors, I don't know if you have medical insurance or health insurance like that, but it's typically, what's your symptom? I'm going to give you a drug. They're like medical Pez dispensers. And so that's ridiculous. That doesn't really help people. So the doctor really has to be a detective. And this is one of the things I'm going to speak at over in Thailand, which is going to be a challenge because I can't use sarcasm. I have to talk slow, and I'm not going to use a heck of a lot of data because if I'm looking at technical data in Spanish, which, I have a rudimentary understanding of it because I've had a clinic down there only 3 years. Yeah, I'm a little slow. So it's more pictures. But I like this quote here from George Bernard Shaw. We have not lost faith, but we have transferred it from God to the medical profession. And that's true because you are seeing the new religion. Now, the censored part will be on stopping the klacha. Okay. But please download this stuff. Okay. I'm going to be posting as much as I can from Thailand. I'm going to try and post some of the unedited talk that I'm going to do down there. And what's going to be wild is I have to wear a mask while I'm speaking. And I was just telling some people earlier, I don't like doing stuff that's stupid. Although, raise your hand if you've ever done stupid stuff. Okay, yeah. But that was like, what's the number one thing that a redneck says right before they die? Hey, watch this. Okay, so we got to be careful of this stuff. So download this stuff, share this, okay? And for those of you supporting Dr. BVIP, God bless you. Thank you. And Extreme Health Academy. We've had some technical difficulties, but man, the forum is up and running. I think it's just spectacular. We're also on Odyssey. We're starting a new one on Telegram. We're starting a new one on... There's like 4 or 5 different sites. So we're trying to get the information out there as much as we can. We're not making as big an impact as the Canadian truckers, but God bless those guys. March 5th, there's supposed to be an event starting in Los Angeles, and that happens to be on a Saturday, so I'll do everything I can to be up there as well. Now, just for the heck of it, this morning, okay, and I get around 50, 60 comments in the morning and about 50, 60 comments in the afternoon on YouTube. And I just pulled up like 5 of them to show you what doctors got to do in order to be a detective. And I'm talking not just simple stuff. Okay, look at the first one here. And I didn't do any typing, and you'll see this one guy from India actually writes with an accent. About if you have hip impingement and labrum tear. Okay, now hip impingement, the hip's down here. Labrum is the kind of the socket that holds it. It's actually it's like a Tupperware coating on the outside that holds it. Now, labrum tear. As a regular doctor, you're going to think, wow, it's a problem with the hip, right? Okay, forget that. Blow that out of your mind. That's ridiculous. That's asinine. If you've got a tear in the labrum, does that mean that your gait is going to be off? Yes or yes? So when you're walking, it's going to be sore. Now, a tear in the labrum, everybody has damage, okay? You might have had a trauma. So it's not that it was torn, it's why isn't it repairing? So that means that when you're looking at the nerve supply to the joint and the blood supply to the joint, now we're looking at pelvic dysfunction. So if that pelvis is off, that houses half the autonomic nervous system. So when somebody comes in and with a hip and labrum tear, I'm not going to say, gee, where does it hurt? Okay, because that's foolishness because you're only getting 10% of the information. But I am going to ask them, take off your shoes. Let me see if there's bunion formation. How many bowel movements a day are you getting? Maybe that pelvis is negatively affecting you. When was the last time, or what kind of medications are you taking? Or when was the last time you had some antibiotics. So see what I mean? So it's not just that symptom of the moment. My husband was told years ago he needed to go on blood pressure med. He said no, changed his job, and his blood pressure's fine. Is blood pressure a random, that you're just effective, that you can't do this stuff? Why would a doctor want to put you on blood pressure medications without asking your physical, chemical, or emotional stress? His wife is the better doctor. He's the better doctor. Do you know what I mean? And I love this one. Sir, how to reverse disc degeneration progress at the age of 40. I am suffering a disc bulge and facet arthropathy due to a fall 1 year. Is herbal medicine can work? Kindly reply with some remedies. Regards from India. I mean, God, they know how to use language. I know. I'll speak American. Okay, so when you're looking at this, this is a disc injury. The arthrosis means that there's a problem with the disc in the back. But when you have degeneration, degeneration is only from a trauma. Now, unless you're laying there all comfortable and someone goes up with a hammer and taps you in the vertebrae, do you think that happened? No. No, this was a whiplash trauma that involved everything else. And some doctor that wasn't thinking just did an MRI. Do you know what I mean? So you got to do that detective work. Degenerative disc disease is the end result of a trauma. So this guy could not possibly have had a trauma to one vertebrae. Okay, those vertebrae are connected. Okay, if you're talking a vertebrae here, then that means the head's off. That means you're altering proprioception. You've altered proprioception, you're changing that input to the cerebellum. See what I mean? So it's impossible to have that. Now, when we go to Thailand, and I'm going to present this one, we have plans of opening a clinic. 6 to 8 months sounds like ridiculous. If we partner with someone, we might be able to do it, okay? But we are also need to train these doctors because what we do is unique. Now, the clinic in Mexico, we offer all of this stuff. I mean, we do the diagnostics, the thermography, rolling thermo, surface electromyography, digital x-rays, live blood cell. We do all that stuff in Huntington Beach and Mexico. But down there, we've got the Huggins protocol. I hope we find somebody over that does that because dental toxicity is huge. We do facial stem cells. We do joint stem cells. But when we're doing stem cells or PRP in joints, we don't do them in joints that have altered biomechanics. You got to fix the body. Dry leading, needling, holistic cancer therapy. This means that you support your body. Okay, now what I'm going to tell the people is the truth. When I'm over there, they'll say, why do doctors go through this training, okay, but you think different? That's because I started late, okay? When I was 30 years old, I was a contractor. So I was used to building stuff, okay? I ran a cabinet shop. And so when you're talking practical common sense, you have to complete this or build this, you've got to solve some certain issues. And I found out when I was hit by a car, I'm talking both my legs broken, sternum fractured, skull fractured, heart and liver bruised, front teeth knocked out. And the medical doctors, they saved my life. I mean, they literally did. But 4 operations later, and they're saying, yeah, eventually you're going to need knee replacements, and I don't need them, okay? I mean, they work, okay? And I realized that they were wrong. And going through the schooling, I found out that a lot of my instructors were misinformed because they're learning by rote, not by why. So now, when I got to human dissection, which I taught on and off for about 8 years, I would see cadavers that were 60, 70, 80 years old with no arthritis. I would see cadavers that were 20, 30 years old with degeneration, crushing, and everything else. So I knew that it wasn't an age thing. And then I'd see the body repairing at every stage. So I got into this with a different view. If a doctor told me something and I had an idea that the body is self-healing and self-regulating, and it went against that, it didn't sit well. You know what I mean? So let's look at this patient. Now, and again, 65-year-olds, wrist pain, high blood pressure, that's what the HTN stands for, headaches, anxiety, and insomnia. And so in modern society, okay, our best healthcare system in the world that is raising the sickest society in the world, where half of us get cancer, okay, again, I have no respect for this. What do they do? For a high blood pressure, you get 2 blood pressure medications, knowing that each one increases your risk of stroke. What do you get for headache? Oh, pain relievers, even those that destroy the gut. Anybody think that you're having high blood pressure because you're not taking enough drugs? Okay. Allergies, non-steroidal anti-inflammatories destroy the joints. Thyroid medications. She never had a thyroid operation, but when you're in a stressed state and you have systemic inflammation, the thyroid's going to appear low. And I'm telling you, 80% of the people in here on thyroid medications, they don't have an issue. And one of the doctors suggested, in this gal comes in and says, yeah, the doctor said the reason I have wrist pain is that one of my bones is too long. I said, dear, you've made it over half a century. Okay, the wrist has only been hurt in a few years. Okay, that means it's worked really good. Okay, so I'm used to dealing with stuff that patients are taught that's not consistent with reality. And looking at her neck, you'll see a reverse curve in the neck. That means she tore a ligament based on the amount of damage. She had a whiplash trauma over 30 years ago. What did she tell me? Yes, I had a whiplash trauma, but I didn't hurt my neck. I got a big bruise and broke a rib. I know. Bullshit. Okay, I can't do that one in Thailand. And we're looking at a lot of structural deviations up there. So when you know that carpal tunnel syndrome, golfer's elbow, tennis elbow is all double crush injuries, which means you have a trauma in the neck leading to this. So I tell her, high blood pressure is not an issue. That's a clue that your body's in a stressed state. The wrist pain isn't an issue because your wrist is fine, but you do have a muscle imbalance. So that means you got compromised nerve supply to it. So the difference between being a prescription Pez dispenser, okay, as opposed to being a detective. Do you know what I mean? Okay, good. So we've got 3 things that could be boiled down at every stressor. And this is where you got to do the detective work. Because I had a patient today. Oh yeah, I got flat feet. It runs in my family. What's the thing I always say? Flat feet don't run. Okay, human beings aren't defective. Okay, so no, they don't run in your family, but sedentary lifestyles, if you're all riding horses, you're all going to have pelvic issues, something. So physical, chemical, and emotional stress. The body responds the same to all 3. The only difference with the clinics that I have is that we address all 3. Okay, that's the only difference. Everything goes on the automatic nervous system. Sympathetic keeps you alive under stress. Parasympathetic is rest and digest. These are located inside of the body, and they adapt based on physical, chemical, emotional stress. So if you're regenerating your body, fantastic. If you have a good autonomic balance, you hear a gun go off, you're sympathetic, but then you go back to normal. Okay, it's just like if you're a deer eating something and you hear a noise, bam, instantly blood supply to the gut shuts down, the heart rate elevates. You look over there, you don't see the mountain lion. Cool, man. Then you go back to eating stuff. Okay, how many people can say that when you get cut off in traffic? No, you're pissed off that guy endangered you and your family for 4 miles. None of these exist. What does high blood pressure look like outside of the body? How much does it weigh? What does fibromyalgia smell like? No, none of these don't make sense. They are all adaptations to stress. The problem is when you have this label, when you have that what do they used to burn in the forehead? Okay, when you have that label burned in you, and you go to a doctor, they look at you not as a human being, but as an inflammatory bowel patient or fibromyalgia patient. Oh, I see here that you've been taking blood pressure medications for 10 years. It's foolishness. Now, I was told by a patient that all 3 of these look the same on the internet. So I circled, or I put a box around the white dot. Now, this is the test we do. We're looking at a sympathetic dominant state, a normal state, and a parasympathetic state. Okay, both low functioning on the right and left side. That means the person's under stress. Let's do some detective work. 67-year-old with brain fog. Where's brain fog? Okay, brain fog means your brain isn't working correctly. Now, the frontal lobe is where impulse control is, anxiety, stress, and depression. That's controlled by the cerebellum. Now, the cerebellum gets all its influence from the body. So we take a look at it. In that big picture on the left, you're going to see degeneration right at the middle of the thoracic area. So this gal had a major trauma, knocked her body off to the side. when you look at the neck, she's got a reverse curve in the neck with over 30 years of damage. So we're looking at a person here, because that's grade 3 arthritis, then you're talking 25, 30 years. Holy moly, 30 years she's had an abnormal influence from a torn ligament in the neck and in secondary injuries in the rib cage. I mean, forget the dental toxicities, because we're seeing some possible cavitations there. So 30 years she's been under stress. Diffuse pain? Hell yes. But what has she taken for the diffuse pain? She goes up to the medical Pez dispenser. Okay, let me have the nonsteroidal anti-inflammatory. Do you know what I mean? So what we do is we found a reverse curve. I said, dear, you tore a ligament in your neck over 30 years ago. How did you know? Well, human neck's curve in the front. Yours is curving backwards. Based on the amount of damage, that means that he tore it. And that's the posterior longitudinal. Now, on the bending film, we can see that the joints are moving, so we can correct it. But does that also mean that she might have the shoulder issue that she thought because she's 67 and she raises her arm and it's sore? I said, no, dear, your shoulders are fine, but you have a secondary impingement where it's compromised here and it leads to joint dysfunction there. She also has a significant right rotation of the top of the rib cage. So I'd look at her and I say, dear, heart palpitations, you know how you feel that little fluttering in your heart and you take a deep breath? She says, yeah, I get that about every month. But you didn't tell me. Well, you can see it there. You're looking at a right rotation. So detective work, looking at the body and respecting that the body is given symptoms for a reason. Does that make sense? Yes or yes? Yeah, I'm not giving you another choice on this. Now here we're looking at the fuse, again, the same gal. This is her standing up straight. She's bent off to the side. So now open up your brain and think about this. We got a gal who tore a ligament in her neck, reversed the neck, damaged the rib cage, and has been walking like this for minimum of 30 years. How's her bowel and bladder control? How's her sleep patterns? She has been in a sympathetic dominant state for forever. How's her tissue production? Okay, I'm going to be 62 in another couple of months, and I'm strong as hell. Okay, this gal's just a few years older, and she's not. Okay, she's got a tissue production problem. So she's not sleeping good. She's not doing any of this stuff. And so, but now, can you see the solution here? So we take the bending films, find out that she's still mobile. There's no fusions in her. She's going to notice a difference immediately. And I can guarantee that. Why? Because she's human. If you got somebody like this with high blood pressure, okay, you're talking week and a half, 2 weeks, maybe. And all you got to do is teach them how to breathe. Tell them about the stress state. Get them to sleep better. Here's a gal, 37 years old with neck pain, okay, of 7 years. Okay, now, hormonal imbalance. What did I say when she first sat down? Now, you don't have a hormonal imbalance. Well, yes, I do. My endocrinologist told me. And I said, no, dear, your body's responded correctly based on the stimuli. Okay, and she's sitting there like this. And I said, you obviously had a trauma. No, what do you mean? And I said, well, dear, you're doing the walk like the Egyptian thing. Your head's like, laterally deviated. It ain't normal. I want to have a mirror on the back of my clipboard so I can know, see? It doesn't work that way. And so when I explained how the cortisol is elevated if you're inflammation, stress hormones are going to be elevated, but those stress hormones suppress the thyroid function. So people will tell you that you're in a hormonal imbalance when you're really not. You're in a stress state. This happened to be your neck. Now, and I don't really want to call him a doctor because that would give him respect. Okay, the healthcare practitioner goes in and says, wow, you have a congenital anomaly in your neck. That's where the neck pain's coming from. The all-seeing, all-knowing. No, and you see this a lot, okay, where joints in little kids that are supposed to be separate, sometimes the growth plate doesn't form, and you'll see some junctions, you'll see some bones that are fused, some bones not. It's a wondrous variety. And I said, dear, somewhere in your past heritage, your kind valued strength over flexibility, and you have less flexibility and more strength. You're probably Republican. Okay, so Now, that kind of humor won't play in Thailand. Okay, you know what I mean? I'm going to be like, ugh. Okay, so when you're looking at this, there is a congenital anomaly. There's some bones that are fused there. That's not the issue. We're also looking at the head is off to the side. Do you think there might have been a trauma? Yeah. So here's a close-up on this. Now you can see those two joints. It's got a waist-wasp deformity there. It's just the growth, the disc didn't grow in. But we're also looking at some damage to the disc below. And I said, dear, you had a whiplash trauma. Now think of this, okay? You have an anomaly in your neck that you were born with. Okay, let's talk to all the doctors out there. But it's been hurting for 7 years. That means it didn't hurt for 30. Okay, good. Just trying to say. Okay, everybody in here has got that light bulb on going, hey, it ain't the problem. Okay, the whiplash trauma causing the degeneration below, because we're seeing the disc get compressed below that, because when you alter mechanics, the area above and below got to move twice as much. But we're looking at evidence of a whiplash trauma more than 15 years ago. You know, did you have cheerleading problems? Were you into dance? Did you have a whiplash trauma? Okay, do you know what I mean? But she bends beautifully. She's going to have 100% recovery. Here you go. Now, after this thermographic thing, I said, look, you have abnormal cell growth, and that's what you can call cancer. Okay, because it is an abnormal cell rapid growth. Now, when we're looking at the breast on the left side, this is where lymph drainage for the gut drains, and that's where 85% of all breast cancers are. 15% are on the right side, and that's where lymph drainage from the dental and pulmonary area drain. So I said, look, dear, you've got a major gut problem here. You've got a lesion or growth there. Then we look at it. Sure enough, what's the x-ray look like in the middle? Multiple deviations. So we're looking at multiple traumas throughout her life. And I said, how do you want to handle this? Because think of this. And again, common sense, this is stuff not taught in schools. Did the cancerous tumor form out of just the environment? Or did the body form it? If the body formed it, then when you look at this, 50% of everybody over 50 has cancerous tumors. 80% of everybody over 80 has cancerous tumors. I saw tumors in so many of the older cadavers, I can't even tell you. But they were walled off. They weren't affecting anything. So the body is literally walling off toxins. Now, and I encourage you to look at a number of the websites. Like Gerson does really good work on cancer. drday.com, Dr. Lorraine Day, who had cancer that metastasized to the chest wall and lungs, and you destroy it not by looking at the tumor as the problem. You look at the tumor as the end result of the body walling off, or it's an adaptive physiologic response based on environmental toxins. And where are they coming from? We're looking at the gut and chronic stress. Does that make more sense? Then when we look, sure enough, we're looking at massive dental toxicities. We're looking at a leaky gut, abnormal bowel gas. We're looking at an old crush injury. This one x-ray on the left up there is the side view of the lumbar. And we're looking at a reversal of the lumbar curve right at the top. And where that top red arrow is, that's the end of the spinal cord. The spinal cord goes, stops up here at the junction of the rib cage and low back. But when you put pressure on there, that's called cauda equina syndrome. It shuts the nerve supply off to the whole gastrointestinal tract. And where's 80% of the immune system? Gastrointestinal tract. Where's the gastrointestinal tract transfer to? Upper left quadrant. Okay? So now you find the source of it. Now, in everybody, particularly in 2022, I ask them, how do you want to handle this? Okay, because you got the cut, burn, and poison on one side, and you got the other side that says, well, let's strengthen your immune system. So I said, look, I'll help with you, whatever you want. And luckily she's going with the natural, because I gave her a couple of numbers to talk to these people, and we'll monitor it. And she's really cool. I really, you end up falling in love with your patients. You really, really do. Here's a gal, and no symptoms whatsoever. But what are we looking at? The left side, left chest, massive inflammatory response. Okay, what drains up there? Lymph from the gut. Okay, we're looking at belly, seat, and thigh weight distribution. So that's cortisol. So she's been under stress for a long time. We're looking at loss of curve in the neck, massive, massive upper right rotation in the upper thoracic area. That's heart palpitations, that's chronic stress, that's liver issues. So this gal, majorly stressed. But wait, what were the three stressors? Physical, chemical, what was the third one? Body responds the same to all three: physical, chemical, and emotional. Do you think that you need to address it in this person? Yes or yes? And that's why no clinic in the world, if they're not addressing the underlying cause, if they're not addressing the three stressors, they suck. I mean, no, I can't say that. Okay, I got to be more politically correct. If they're not addressing the three stressors, they're missing something. Okay, is that more PC? It's not me, but I'm going to try and suck it up. Okay, this is the bottom. I mean, okay, the sacrum. Okay, nobody in here has a tailbone. If I have one more patient tell me it's a tailbone, okay, I can't really say that because I get that every day. It's my tailbone, doc. Okay, no, you never had a tail. Okay, in the 1300s, they were, plethora of dead bodies, and they wanted to use some human dissection. They wanted to make sure that the soul wasn't in there. And the only bone that's three-sided is the sacrum, and it's at the base of the spine, and everybody knows the spine is where the source of all life is. Why? You get damaged in the spine, you're pretty much done, okay? And so they called it the sacred bone. We call it the sacrum. Is that prettier than a damn tailbone? Okay, yes, it is. Okay, so now the red arrow is the area that we're looking at here. Now we're looking at two reverse discs in the side view of that. That's a bad injury. Imagine if you could not sit, you could not stand, you couldn't lay down. This is wearing you out. Your bowel and bladder have to be evacuated every 10, 15 minutes. You are just worn down. Next to that are two restored discs. That's the same patient. Okay, I mean, this is horrific that somebody has to go through that. And she went to every friggin' doctor. And no one's saying, dear, your body's responded correctly based on the stimulus. Your body's responded correctly. Every drug to suppress her body's awareness of what was going on with the bladder, everything. I mean, just criminal. How long does it take to regenerate a disc? I don't know. It's really based on your physical, chemical, or emotional stress. You start year 1, year 2, and you're seeing the disc start to regenerate. Okay, how long does it take? Your body can produce every red blood cell brand new every 120 days. Your skin is produced, but if you have stress, if you have physical, chemical, or emotional stress, you have a tissue production problem. What do people with chronic illness or disease have? 100% have a tissue production problem. This is a tissue production problem, but it's also criminal activity. 10-year-old with behavior issues. Behavior issues, what is that? That's frontal lobe. That's anxiety, stress, and depression. Okay, there's three stressors that would cause this: physical stress, chemical stress, and emotional stress. Do they look at if his mom had Pitocin? Does he have a loss of curve in the neck? Did he have an ear infection? Do you know what I mean? No. Behavior issues, you go in and give him an antipsychotic or kitty cocaine. Okay, what is it? Adderall? Okay, the prescription meth. Okay, you look at this and you say, God, that's criminal. Because these kids are responding correctly based on the stimulus. 8-year-old with ulcerative colitis. Do you think he's not taking enough steroids? No, these kids are screaming that they're having a problem. And there's three things that they're going through. They have physical stress, chemical stress, and emotional stress. And their body is adapting through having the ulcerative colitis. 8 years old, you eat something and your gut burns. Okay, that's criminal that it's not. 5-year-olds with ulcerative colitis. If I showed you a baby deer with ulcerative colitis, would you want to give it steroids or would you want to find out what the hell it's eating? Okay, here you go. Back surgeries and screws. This is why one of the 7 questions we say, look, do you work with post-surgery patients? If you got one surgical fusion, you're talking around a 70% failure rate within 5 years. 3 surgical fusions, you got a 90 to 100% fusion rate. This is the most abortion that I see. It's when you bolt the lumbar to the sacrum. That means that you're permanently going to have an SI or sacroiliac joint problem. But you can see here, initial 6 months, 1 year, 2 years, the disc right above the surgery, it's getting a darker line, it's starting to grow. And yes, he's able to golf again. That was it. Man, some people like golf more than anything. Here's a hip regeneration. But the problem is, and this one I should have blown this up because you can't really see the dark one, and over there on the light one, it's too small. But not everybody has perfect hips. I mean, I think Carl, Lewis, Usain Bolt, okay, probably have perfect hips. But what happens is if the hip isn't fully into the socket and the socket isn't fully formed, the body remodels that socket, okay, and it's going to grow bone around it. And I think that's what I'm going to do when I'm on the plane tomorrow, okay, is grow this up, because you're going to see there's like a 3/4 of an inch that the body laid down to stabilize that hip joint. The body is brilliant. It's beautiful. But if you have a damaged hip, do you think that you need to stabilize the pelvis because your gait is going to be off? Do you think maybe the feet and knees are going to be off? Do you think the shoulders going to be off? Do you think there's going to be, how many bowel movements a day are they getting? How are their sleep patterns? How's their emotional health? You know, you're a young guy, you know, and your hips sore, you can't run after your grandkids. You know what I mean? All 3 have to be addressed. Boy, that was really hard. I talk slow, okay? And so this right here, when we talk about the 5 keys of health, I'm not talking about symptoms. Symptoms, if you give me the greatest symptom in the world, okay, you're only telling me 10% of what's going on with your body. Okay? What I'm looking at is why the symptom is there and realizing that the best you can tell me is 10%. 90% of this stuff is unaware. And they don't teach that stuff in doctor school. They teach you to do stupid things, okay? Like, when was the accident? Oh, the accident was in 1986. Was the impact from the back, the side, or the front? The hell do I care? No, I just put it down. It takes 2 hours to do a physical when you're first in doctor school. You have to ask a dang questions like that. Now, I look at a person and they're talking to me like this. I say, when did you hurt your neck? They'll say, I never hurt my neck. And I'll go, yes, you did. And I'm going to find out. I was just hoping for a cool story. I don't know. You know, bucked off. I've had people falling off of elephants, blown up, tiger attacks. I've seen like lots of really, that's what I was looking for. Something neat. No, I slipped on the ice. Big deal. Okay. Proper nerve supply. You need this because that's how you adapt to the environment. You need to have movement to stimulate the brain and to get your body healthy. You need to have proper nutrition. That means you need the raw materials to rebuild your body and brain, okay, and gut. And when people say, well, no, I don't like plant-based. Plant-based means you're eating animal products too. Vegan means you're only eating plants, okay? And let me tell you, there's not a lot of vegan cultures. You got to supplement with B12, but there's a ton of vegetarian cultures and a ton of cultures that eat nothing but meat. You know, I tell people you're going to eat what your great-grandparents ate. And they'll look at me like this. Yeah, they were whacked. They only ate organic, seasonal, and whole food. Yeah, that's all that was there. Don't give me that shit. Sufficient sleep. Look at our Dr. BVIP. If you're having trouble sleep, by God, get that course. Okay? Detoxing, get the course from there too. We're trying to put everything. We're getting an education site. And prayer and meditation. My gosh, I pray over at the patients. Okay? And they don't even know. You know, I'm looking at the x-rays, I'm palpating the body, but God, you know, if you can have a higher power guide your therapy, that's pretty good. You know, that's like having, God, I wish I knew sports, because it's like having Dick Butkus behind you. Okay, I just saw him in the movies, you know, big guy that's going to kick butt. So find the source of it. Okay, do not go to the medical prescription Pez dispenser. If they tell you that it's hereditary, bullshit. Okay, because you can name 3 or 4 relatives that you got that don't have it. Okay, if they tell you it's congenital and you've had it your whole life and it's just starting, no. Okay, find something else. If they say, wow, here's a pill for your ill, why do I have it, doctor? Just had a gal, Hashimoto's. Really? Is Hashimoto's disease hyper or hypothyroid or both? It's both. Yeah, that sounds good. Okay. What's it from? Well, we just don't know. Okay, good. I said, hun, you don't have Hashimoto's. You are going to have a leaky gut. We're going to see it on an x-ray. Sure enough, you're going to find some kind of stressor there. Your body's responding correctly based on the stimuli. Correctly? I have no energy. Yeah, correctly. Let's find it out. Okay? But now we're going to delve into things that are scary, that in the current tyrannical environment that we're living in, science is not allowed to be a discussion. And it should scare you just to think, if people are so afraid of having a discussion on a topic, okay, maybe they're not real confident in their side. So thank you very much, YouTube and Facebook. Hopefully you guys got it all. Did it go out? Okay, bitching. Good. Okay, God bless you. And I'm going to send a bunch of short live videos next week from Thailand, unless I can. Will you guys fit in my luggage? Okay, John might be ready. Okay, buddy. Thank you very much. God bless you. I'll see you later.